I'm Dr. Pamela Stallo, Medical Director with Aetna and Board Certified Pediatrician, and I'm going to give a presentation today on pediatric health and wellness with a back-to-school checklist by age group. And I just want to tell you a little bit about myself. I'm a Board Certified Pediatrician who spent most of my 30-year career in private practice. I was there for 28 years, and the final 2 years I served as a pediatrician on staff at the faculty of Joan C. Edwards School of Medicine in Marshall University, and was directly involved in medical student and pediatric resident education. Following that, I joined Aetna as a medical director last summer after 30 years in practice. And my biggest credential that you might be wondering about, yes, I'm a parent. I have a son who's 25 who just graduated from grad school with his MBA. So I'm a parent as well. Well, I'd like to begin by just discussing some general aspects and the three primary domains of health and wellness: physical, the second mental, and the third social. And emotions and perceptions about things, internal things, our own perspective on things, and social wellness being our interaction with others. So more of our external perception about things, how we interact, how we relate to others. So these three aspects, these three domains of health create the health triangle. And general health and wellness is a balancing act. And we try to keep these three aspects of health in good balance to give us an overall good outlook. And as you can imagine, there are many things that can affect these three aspects of health. Our physical health is affected by our nutrition, our physical fitness, how we take care of our bodies, personal hygiene. Our social health is affected by how we get along with others, how we maintain relationships, giving and receiving support to others, those types of things. And our mental and emotional health has to do with our own internal perceptions, our values, our feelings, our emotions, how we manage stress. And of course, there are many things that can cause our health triangle to get out of balance. The first being biology and genetics. We all have certain predisposition for certain diseases. We have hereditary risk factors, such as for high cholesterol, high blood pressure. We may have genetic syndromes, for instance, Down syndrome, those types of things that are genetic syndromes that cause health issues. There are environmental things that cause things to get out of balance, literally speaking, things like being around secondhand smoke, cigarette smoke, and more abstract ideas of environment, your family environment. Do you have a family that's supportive for children? Very important to have parents and a family who are nurturing and offer support and love and take them to the doctor when they're sick and take them for their health and wellness visits and their vaccinations. Your social support network can affect your health, whether or not you're in a very supportive environment or not, whether you have access maybe to services. And your attitudes and behaviors. Are you compliant with medical advice? Are you making your own wellness checks and those types of things? So those can all cause the health triangle to become out of balance. And speaking of out of balance, the biggest thing that caused the health triangle to get out of balance for all of us in the past couple of years, of course, was COVID. Basically, everyone's health and wellness took a hit while everything was shut down. Not only were elective procedures and such canceled and unavailable, but necessary procedures, health and wellness visits, necessary screens like colonoscopies, everything shut down. Vaccinations for children. Everyone was behind on immunizations. We've been playing catch up the past couple of years. Dental care. There was an adverse effect, social and anxiety and depression because of the social isolation that took place during the pandemic. And definitely a negative cognitive impact in the United States. This has been borne out as far as test results. All 50 states have shown some adverse effect in areas of learning, which has been demonstrated on cognitive test results because of the necessity of remote instruction, which does not take the place. A lot of catching up to do since COVID, and everyone needs to get caught up and get their triangle back in balance. Okay, so I'd like to begin by just discussing the general visit schedule for pediatrics. In the United States, the American Academy of Pediatrics has a regular schedule of periodicity. This is available on the website, www.healthychildren.org. For those of you who are abroad, I'm sure that your visit schedule is fairly similar. It begins with after birth. Babies have a weight and jaundice check within 3 to 5 days after birth. At 1 month of age, there's a well check. At 2, 4, and 6 months, they're coming for visits and vaccinations. Then we begin to spread out the schedule a little bit. There's an every 3-month schedule, 9, 12, 15, and 18, and then every 6 months, 2, 2.5 at age 3, and then yearly after age 3. And generally speaking, with pediatrics, we encompass up to through age 21. And of course, the overall importance of health and wellness visit, what takes place at those visits. We're monitoring physical growth. They're getting measured, weighed and measured, and plotted out on standard growth curves that are established by the Academy of Pediatrics. We're monitoring developmental progress from infancy through childhood. We're doing some monitoring of emotional status, particularly for the older age groups, older grade school, middle school, and high school. They're getting vaccinations that are very important for health and wellness, and just general anticipatory guidance advice. So if you're interested in looking at the United States immunization schedule, it's available on multiple websites, including cdc.gov. There's a well-established schedule that's recommended by the American Academy of Immunization Practices, and each state does have the right to slightly alter this vaccination schedule, and there are slightly different requirements by state, which you should be able to find on your local state government websites. So I'm going to begin with our checklist, and for the infants and newborns, we'll call this a daycare checklist rather than a back-to-school checklist. So for newborns and infants, what's happening at the well visits is immunizations are beginning. At birth, they're getting their hepatitis B vaccination, and then the primary series is beginning at age 2 months. So if your immunizations are not given by your provider when you're coming for the checkup, you should obtain a list of what is due for your child and find out where your local health department or other access for vaccinations may be, so you can obtain those needed vaccinations. Also, we're discussing developmental stimulation, and for infants, this is very important for them to have human contact, touching, talking, singing. For daycare requirements in this age group, generally, most of them will not accept them into daycare until they've had their first set of primary immunizations at 2 months or 8 weeks of age. There are exceptions to this. Usually you would need a physical exam form filled out that they're safe to attend daycare, and also any immunization, any medications that they may be required to be administered by the staff while they're there. You would need written record of that from your physician. At these visits, we're discussing anticipatory guidance that includes basic things with caretaking of infants, feeding, their sleep routines, discussing avoidance of sick contacts, which becomes an issue when they do have to attend daycare. Sibling rivalry, older siblings that may be jealous of the baby and trying to prepare them for having a newborn in the home. Things like crib safety, careful with bumper pads and putting things in the crib that could potentially be to roll over and have breathing issues, and safety issues when they become mobile. Usually they begin to scoot and crawl between 6 and 9 months of age, and then they become mobile. So you have to be mindful of stairs and steps. Make sure that you have gates so that they can't fall. Protecting sharp corners of fireplace hearths with a bumper pad. Caution with walkers. They can easily tumble downstairs. And cords and strings, pulling on things like a hot curling iron. I've seen some horrible burns that were just horrible accidents that were inadvertent, where an infant was crawling on the floor and had access to that cord. And then, of course, storage of your cleaning solutions. They like to explore drawers and cabinets and open them up. And so you want to have safe places for them to make sure your cleaning solutions are up high, out of reach. And then, of course, car seats. Those guidelines change as they get older. Generally, they're rear facing until age 2. As they grow, they can outgrow their seat. And so you have to be aware of the manufacturer guidelines on those. And as we discussed with mobility, the safety of exploration of infants who are crawling around on the floor, they have a propensity to put things in their mouths. So you always want to have poison control phone number handy in the United States. It's 1-800-222-1222, and they can easily give guidance about whether or not you need to seek emergency care, or if it's for something you would need to induce vomiting, or if it's something that you could just observe at home. They have all that information at their fingertip. And teething guidelines, usually the first dental visit is recommended around age 1 or whenever they have 6 to 8 teeth. So dental care begins early. And poison control, we discussed. This is the well-known icon, Mr. Yuck, that used to be present on things that were harmful for ingestion. I'm not sure it's really being used much anymore, but it was a pretty effective icon. But again, keep that poison control number handy, both for you and for all family members or child caretakers. They should have access to that. Okay, the next age group will be our toddlers, age 12 to 24 months. So they're mobile, they're beginning with speech and language development. This age group is 12, 15, and 18 months, and then at age 2, they have their visits. They're getting immunizations at these visits. Again, if they're attending daycare, those immunizations need to be up to date. You'll have to have an immunization record with proof of that, as well as a physical exam, the most recent physical, and that they're certified that it is okay for them to attend and be around other children. Generally, it's good for them to have some socialization with their peers. And they often will perform some developmental stimulation at daycare, things that we're looking for in this age group: learning their letters, their numbers, beginning with speech and language development. They're developing their fine and gross motor skills, so doing things like puzzles and things that they can take apart and put together. Stacking blocks, those are good. Fitting the shapes into like the square into the square hole, and like a pegboard. Those are helpful. And this is a time when we're monitoring for autism. So your provider at these visits should be administering a questionnaire for you to complete called the MCHAT, which is the Modified Childhood Autism Screen Revised. That's usually administered at the 18-month, age 2 and 2.5-year visits. If you're interested in what is on that particular questionnaire, is autismspeaks.org. It's also available on other websites. I believe the American Academy of Pediatrics has that as well. But if you are interested in what questions are on that questionnaire, it is a weighted questionnaire, and some questions are more important than others. But your provider would make a referral if there were concerns with the results of that screen. So going back to the anticipatory guidance for this age group, again, developmentally, they're mobile, so you have to be mindful of safety issues, things that are in the floor, things they can pick up and put in their mouth. Again, poisons and ingestions are so common in this age group because of their propensity to do that. So keeping the poison control number handy is for your family, and also for any caretakers, is very important. Being aware of choking hazards, especially even with eating, things like chips, large chunks of food like a hot dog, things like that are common choking hazards. So just being mindful of the things they're eating, making sure they're not ingesting things that could potentially cause choking. Bathing safety, being very careful with the temperature of the water. Stairs and steps, we discussed that as well, making sure you have a gate. Establishing good routines for sleeping, eating, waking. Other water safety, being careful if there's a pool on the premises, making sure you have a cover, and even the toilet, making sure that the lid is down. I've seen some unfortunate accidents with that, as far as putting their head in the water. They just have a curiosity about things. So that's always something to be mindful of. This is also a common time for separation anxiety. There's beginning to learn who's familiar, who's not familiar. And so if you are thinking of daycare, even if it's just part-time, it's good to introduce your child to small amounts of separation away from you in anticipation of that first day. If they've never been away from you, then it's a common time for anxiety, and they're commonly clinging to your leg when you're trying to leave. So maybe just making arrangements to have a friend or family member come and stay with them while you go to the grocery store or run an errand, and then you can gradually spread it out to larger amounts of time if they're going to be involved in daycare, especially multiple days per week. Okay, we discussed the autism screen and the MCHAT questionnaire that your provider should be administering at those visits, and you can review the questions at your leisure. The next age group will be our preschool age group, which is more of a back-to-school checklist. And at these visits, again, they're getting immunizations up through usually age 18 months or age 2, depending on the schedule that your provider is adhering to. They're should be getting regular dental visits by this time. Usually they have a full complement of teeth. So you want to be performing dental care at home and also taking them for dental screens as well. Developmental stimulation. We're wanting to, again, see progression of speech and language. We should be fostering independence, teaching them how to get dressed and undressed and brush your teeth and just perform some basic self-help skills using utensils, becoming better with a spoon and fork, and then basic motor skills like pedaling a tricycle, so a big wheel or a tricycle. Those are all good developmental stimulation for them at home. Anticipatory guidance for this age group. Again, the car seats, they're outgrowing their infant seats, so they may need to move out to a toddler seat. Establishing those good routines we talked about with sleeping, waking, and feeding. And also water safety. We discussed pool safety, and with the toilet in the bathroom. If there are firearms in the home, again, they have a curiosity about things. They want to pick things up. They may have toy guns. They may think it's a toy. It's very important to keep those under lock and key and to keep the ammunition separate. Okay, so the next group is our primary elementary school age group. So they're getting older, they're going off to kindergarten and first grade and grade school. So for your back to school checklist for that, most of the kindergarten screens and for primary elementary school have a form that needs to be completed by your provider. Also, they usually need proof of immunizations. So those were the two most important things you would need to obtain prior to going back to school. Also, this age group, by this time, many of them have been identified perhaps to have some food allergies or some other environmental allergies, such as to bee stings or things like that, for which they may need an EpiPen. If there are any significant allergies for which they had an anaphylactic reaction, the school needs to be made aware of that. And there's usually a form that needs completed for that as well. And you would also need to bring a prescription for them to have not just at home, but at school in case of accidental ingestion of the food they're allergic to or exposure to that accidentally, or a sting or whatever may cause them to have the reaction. So you would need a dual prescription for these medications, and they need to be kept on hand with the school nurse. Also, in elementary schools, a common time for diagnosis of some cognitive disorders. They may require some special education or some services such as physical therapy, occupational therapy, or speech. And you would need to have orders in place for that as well at the beginning of the school year for them to be eligible services while they're at school. Children that have ADHD, they sometimes need some classroom modifications. So they may require what's called a 504 plan in the United States, where they have opportunity to have more time for test taking. They can even take their test in an alternate location, one-on-one. They can receive their instructions verbally, things such as that, depending upon the severity of their symptoms of ADHD. Some of them may also have medications that need to be administered at school. And again, you would need a form completed for this and to have a separate prescription, usually for these medications, because they are in a controlled substance category with the DEA. The school would require a prescription bottle from the pharmacy with the actual directions on it. So again, that's something that would need to be taken care of in advance. Some of the anticipatory guidance for this age group, one of the biggest things, again, because they're separating from you for long periods of time, is to discuss stranger danger. There, as we know, unfortunately, there are perpetrators of harm to children who lurk around schools, and parents need to discuss with their children not ever to get in the car or approach a car of a stranger. They have tactics such as using puppy dogs and things that are very appealing to children. So again, it's one of those unfortunate things that we do need to discuss and prepare for them and make sure they're aware that they should never get in the car with a stranger. Generally, when they attend school, they should begin to learn their name, their address, and their phone number. This is something that sometimes is hard for them to remember because things are so automated with cell phones. They can press a button that says mom, but they don't really know how to contact mom. So these are important things we really need to teach them as far as learning their phone number and their address and their full name. With regard to riding in the car, they're moving up to a booster seat, usually in this age group. In the United States, booster seats are, in most 50 states, is from age 4 to age 8 and goes up to 56 inches tall and 44 pounds before they can graduate to just a shoulder lap restraint. So you need to be aware of the guidelines for your state and when they can transition to a seat belt. Generally, they should not be in the front seat of a car where an airbag can deploy until age 11 because it can cause injury. In this age group, we're wanting to foster independence. They should be increasingly independent with their getting themselves dressed and brushing their teeth and feeding themselves and all their learning their personal hygiene. And again, we discussed firearm safety, water safety, and now they're beginning to maybe ride bicycles with training wheels and taking training wheels off, so they should be wearing a helmet. So bicycle safety is another important part of anticipatory guidance in this age group. Okay, the next age is our middle school or junior high school children. So this age group, upon middle school entry, they usually do have some vaccinations. Most commonly, the tetanus and the meningococcal vaccines are required. So proof of these vaccinations would probably need to be presented to your school. Again, children with cognitive issues or classroom modifications for ADHD may need 504 plan forms completed. So those would need to be done in advance. And then again, if they're having medications that are administered at school, you would need to bring those to the school on a monthly basis. Or if they have allergies and require an EpiPen, asthmatics maybe that need an inhaler as they begin to become more active in phys ed classes. Some asthmatics need to pre-treat with their inhaler before gym class or before sports. So in order for them to self-administer those medications, they would need forms completed for that. Emergency contact information. Again, this is part of all age groups, usually for school. And some children in this age are still receiving some services such as physical therapy, occupational therapy, and speech. This age group is becoming increasingly independent and spending time away from you, including on social media. So this is a big anticipatory guidance discussion for this age group, is taking control of their phones, their social media accounts, their internet use, making sure that you are the police and that you have control over what they are viewing. Social media pressures are unbelievable in this age group. I'm thankful that I did not have to grow up in that environment. I think it's very hard on them in many ways. But obviously something that can give them pleasure and entertainment as well, but it is with caution. So make sure that you have control over all of their viewing, and mindful that, again, internet people have sometimes harmful intentions, and they should be very cautious when speaking with strangers and people they don't know online. One of the things that your provider should be doing at adolescent wellness visits is administering a screen of emotional health called the PHQ, which is the Patient Health Questionnaire, the adolescent version. It's a 9-question survey for anxiety and depression, usually begins at age 12. And this should be something that the child is completing and not the parent. Sometimes they're more willing to disclose their true feelings when it's an impartial person who's asking rather than a family member. And I have many times been surprised when I look at the questionnaire that was completed in the absence of a parent, and it's very concerning for serious anxiety or depression. So again, this is something that we should be looking out for in this age group. And if you're interested in the questions that are present on the screen, you can go to apa.org or the NIH website and see those questions that are present on the adolescent version. Many of us, when we go for our own wellness visits, we are completing the adult version of this questionnaire at visits. So there's more than one version, but there is one specifically geared towards adolescents. Okay, high school age groups. This age group is very independent. Again, they should still be coming yearly. After middle school vaccinations are administered, kids commonly will drop off the face of the earth as far as coming to see their providers on a regular basis. Unless they're needing a sports physical, we don't get them in the door lots of times for their yearly wellness visits. So it is important still for them to go yearly. There is a high school vaccination requirement, usually for a second meningococcal booster. So usually at a minimum, they would need that vaccine and need to show proof of that. For all of them who are participating in sports, of course, they would need sports physical forms completed, that they are cleared for participation. Most of them who have medications, prescription medications that they may need access to school, at school could self-administer these medicines. But again, in order for them to officially that and be able to administer it in class or on school premises, they would need a form completed and also to have spare medication present. Their EpiPen, they should have a spare EpiPen in the office. They can also carry one independently and be cleared to self-administer by their physician. Diabetics who may need to do AccuChecks or administer insulin injections at school. Again, for them to do that, they would need forms for clearing them to do this at school and what their regular regimen is. The school nurse should be aware of that. And their glucagon emergency kits in case of a hypoglycemic reaction. So these are all things to think about in advance. Anticipatory guidance for high school age group, they're getting their learner's permit and they're driving. So driving safety is a big discussion for this age group, making sure they're wearing their seat belts, making sure they're not distracted when they're behind the wheel, not looking at their phone. That's a huge thing, looking at those notifications that are coming in, make sure they're putting their phones down and not being distracted while they're behind the wheel of a car. This is a very common time for substance use and experimentation. So cigarettes, vaping is probably the most common form of substance experimentation in the beginning. So Juul, these cartridges are very easy to conceal and even attempt to do in class, a lot easier than a conventional cigarette. So these are things that we need to discuss with them. And then, of course, other forms of substance use, alcohol, THC, and that can be a gateway to other substances. So always wanting to be aware when they're attending parties that that you discuss with them. Never, ever get behind the wheel of a car. If they do decide to make the decision to do experimentation with alcohol or THC or other substances, that they need to be aware that never with a driver who is impaired, and that they should never get behind the wheel of the car themselves. If they are impaired, they should always have a designated driver, and you should always have be able to contact them when they're away from you. So again, screen time, social media, huge for this age group. So you still should have control over what they're viewing and be able to have access to it. And of course, in this age group as well, sexual experimentation, if they are going to be sexually active, you need to make sure they're aware of how to protect themselves from pregnancy and sexually transmitted diseases. So the final stop is the college age group, which most of us are seeing patients until age 21. So I had many college patients in my private practice. So your college checklist, again, there are forms, admission forms, some of which may have a physical if they're going to be living on campus, so in a dorm. So these would be forms that may need to be completed by your provider. You almost always have to provide an immunization record. So those meningococcal vaccines and recommendations for some vaccines which may be highly recommended but not required, like the meningococcal B vaccine. That would be a good idea, especially if they're going to be in a dorm. Hepatitis A vaccinations. There are many vaccines that may not be required but would still be a good idea to obtain just if they're going to be in close quarters in a dorm away from home. So these would all need to be completed in advance, and of course emergency contacts. And it's a good idea to go to their orientation if you can, to help point them in the right direction of where they maybe can go if they get sick when they're on campus. Usually there's a student health clinic where students can just provide their student ID, be seen if they have flu symptoms or a sore throat or they're ill. Campus safety, again, just discussing with them about walking places at night unaccompanied, just general anticipatory guidance for safety away from home. Again, substance use and experimentation and experimentation, these are all things that we need to discuss with them prior to leaving home. Driving safety, again, not getting behind the wheel of a car when they're impaired, and not ever getting in the car with an impaired driver, always having a designated driver. And just the screen time and the social media, again, you're away from them, so you don't have complete access to everything that's being viewed, but just making sure that they're socially minded. So this is the back to school checklist for all age groups, and hope you've enjoyed the presentation and maybe brought some things to out that were helpful. And I'll be happy to field any questions. Well, I have a couple of questions. That the number to call if your child ingests poison, I think we went over the poison control number, 1-800-222-1222 in the United States. I'm not certain how what the recommendation is for those of you who are abroad, but that is the best thing to do before you make any further decisions about care, is to call that number. Okay, the second question I have, how can I tell the difference between a cold? Well, it's very difficult to tell the difference between flu and a cold for your child. They do have many similar symptoms. In general, flu has a higher grade fever, usually above 101. They appear more acutely ill. They have more body aches and malaise than just a cold. Usually a cold is a low-grade fever. A cold lasts for 5 to 7 days. A flu usually is fairly short-lived, about 3 days, but the acuity, the way they feel and the way they look appears much more severe. So we are up against flu season right now in the United States. Most of the recommendations for most areas of the country would be at the beginning of September to obtain a flu shot. That's the best way to protect against the flu. But of course, once they're going to school or daycare, it's a given that they're going to be exposed. And flu shots are not protective, although usually at least about 68%. But if they're having high-grade fever, severe malaise, severe cough, and definitely the earlier you're seeing, the better, because the flu is one virus we have good medicine for, and that's Tamiflu. So, and it's most effective for lessening the severity and duration of symptoms if it's given in the first 24 to 48 hours of symptoms. So with those high grade, definitely take them right away for a flu test. Okay, here's a good question. When should I call the doctor about a fever? Well, fever, of course, is actually one of our body's defense mechanisms. So fever's really not a bad thing, but fever makes you feel bad when you have a fever. And it's very important to evaluate infants who have a fever, because they can have very severe infections that become very severe very quickly. So for infants under the age of 6 months, if they have a fever, they should go to the doctor. After the age of 6 months, it's okay to watch the fever for a day or two and see what progresses, what kind of symptoms come. You can give some Tylenol and fluids. Generally speaking, they should stay home. They should not be attending daycare, preschool if they have a fever. And we shouldn't be going to work if we have a fever as adults either. But so that's something that you can observe. But in the under 6 month age group, I would always schedule an appointment with your doctor for a fever. Generally speaking, the other signs of concern would be excessive fussiness and irritability, refusal to feed, difficulty breathing. If any of these other things, especially accompanying a fever, they should always be seen by a medical provider. Well, thanks so much. If there are no further questions, then I will bid you farewell. I hope you in this quick but comprehensive back to daycare and back to school checklist and overview of pediatric health and wellness. Thanks for attending.